I am Dr. Wadskier, one of the infectious disease physicians at Memorial Health System, and I just want to give you a couple of facts about the coronavirus disease 2019. As a health system preparing for community health concerns, potential outbreaks and situations like the coronavirus disease is part of the work that we do every day. In December 2019, there was a cluster of pneumonia cases in the city of Wuhan in China. After further investigation, it was known it was related to a new or novel virus. Given that it is a new virus, what is known about the virus now might change in the future. This is an emerging and rapidly evolving situation, and information will be updated as it becomes available. It is a challenging situation, in part due to the presenting symptoms, which are similar to influenza symptoms. The risk of infection for the U.S. population remains low. While the risk in our community is currently low, we are paying close attention to what's taking place across the country and ensuring that our teams are well educated and have the resources they need as we care for our community's needs. The number of cases is increasing and will continue to increase as more information is available and more people are tested. How long someone is actively sick can vary, so the decision on who to isolate and when to release someone from isolation is made on a case-by-case basis in consultations with physicians, infection prevention and control experts, public health officials, and involves considering specifics of each situation, including disease severity, illness signs and symptoms, and results of laboratory testing. The exact dynamics of how the virus is transmitted is yet to be determined. It is now known that there is community spread, meaning person-to-person transmission from someone who is actively sick with the virus, spreading the illness to others. In general, respiratory viruses are usually transmitted through droplets, by coughing or sneezing, or being in contact with a contaminated surface or object. What is known so far about symptoms associated with coronavirus disease 2019 range from mild symptoms in about 80% of the cases, such as common cold symptoms including cough, fever, shortness of breath, with higher chance for self-recovery, to more severe symptoms and disease in about 15 to 20% of affected patients presenting with pneumonia, organ failure, and even death. The mortality rate is not known yet. The testing for coronavirus disease 2019 can currently only be performed at the CDC or designated laboratories. There are very specific laboratory requirements for specimen collection, handling, and shipping. We will provide specific instructions if a suspected case presents to one of our facilities. How to protect yourself. Avoid touching eyes, nose, mouth, and face. Cough or sneeze using the elbow to cover mouth and nose. Avoid close contact with those who are sick. It is not recommended for people who are not presenting with respiratory symptoms to wear a mask. This is due to the risk of contamination of the mask, and since it has been shown that there is an increased risk for getting infected, as people who are not used to wear a mask tend to touch the face frequently, representing a risk for infection. The use of a mask is recommended for people presenting with respiratory symptoms. Wash your hands at least for 20 seconds. If water and soap is not available, it is recommended to use an alcohol-based hand sanitizer. Stay home if you're not feeling well. For the population in general, try to avoid crowded places. This is more important for patients with known underlying conditions like cardiac, respiratory, or immunosuppressive conditions. If you are presented with symptoms like fever, cough, or shortness of breath, seek medical attention early and get a flu vaccine. As a healthcare institution being in the front line and preparing for possible cases of coronavirus disease 2019, we follow the recommendations from the CDC in collaboration with local health departments to provide the most updated information and guidance to our teams. Our teams are educated on signs and symptoms to watch for, and we have implemented a process when patients arrive, whether in our clinics, Physicians Care Express, or emergency department as suspected cases. We also have strict cleaning techniques and protocols we follow every day to reduce the germs and ensure a safe environment for our patients. We use specialized cleaning products, including the Synix robots, which is a germ-blasting technology that uses pulse ultraviolet light to destroy bacteria, viruses, mold, and other pathogens. If you are concerned about symptoms and don't want to stay at home but speak to a provider, we have a couple of options for you. Here at Memorial Health System, we count with the 24-hour nurse triage line with nurses who are standing by to talk about your symptoms and guide you in your care. It is important that if you are presenting with symptoms, call in advance and try to avoid going directly to the emergency room, to reserve hospital resources, and to avoid for a large number of people getting medical attention when only presenting with mild symptoms. We also have an urgent care virtual app that you can download onto your phone or use from our website. Once you register, you will be connected to an emergency care physician who will address your symptoms over the phone or direct you to come into the emergency room. You can download the app from your app store or your phone or by visiting mhsystem.org. We are also preparing in the event we see cases and patients who need to isolate themselves in their homes. We can offer virtual visits from physicians to ensure they have the support they need during their recovery. We are here to help you, and as more information becomes available, we will take action based on the most updated recommendations.